Hello, and welcome back to the Unplugged podcast. I'm your host, Tiana, without Landon this week because Landon, he isn't here to film this. But today's topic is very sensitive. So before I get into this, I do want to give you guys a warning if you are sensitive to things like suicide, things of that nature, talks of depression, talks of bullying, then I suggest that you scroll off. Today's episode is called Behind the Screen, Social Media and Mental Health in High School. Thank you to everyone listening, and today's episode is about mental health, social media, and how it affects high school students. Most teenagers use social media every day. How we use it to talk to our friends, how we use it to keep up with trends, and relax whenever we're bored. Social media can be fun and helpful, but research and real-life experiences show that it can also negatively affect mental health, especially in teens. In this episode, I'm going to talk about how social media impacts high school students, why teens are more affected than adults, and what we can do to create a healthier balance. One of the biggest social media effects through teens is comparison. In high school, it's already easy to compare yourself to others. Grades, popularity, appearance, relationships, social media adds another layer to that. For example, you might scroll through Instagram and see someone from your school posting pictures where they look confident and put together. Even if you know that photo is edited or carefully posed, it can still make you question yourself. This kind of comparison can lead to low self-esteem, especially when teens compare to their real everyday lives to someone's online highlight reel. Another issue is how social media connects self-worth to numbers. Likes, views, comments, and followers can really start to make a measurement in popularity or value. In high school, this pressure can feel even stronger because peers you see every day are the same people are interacting with your post. For example, some students feel embarrassed if a post doesn't get many likes, or they delete it because they worry how it looks to others. Others may feel anxious, waiting for people to respond to messages or maintain Snapchat streaks. Over time, this can create stress and anxiety, especially when teens start caring more about online approval than their own feelings. Social media makes it hard to fully disconnect from school life. In the past, school drama usually stayed at school. Now, group chats, posts, and screenshots mean that issues can follow students home. Even during free time, teens might still be checking notifications, keeping up with conversations, or worrying about what's happening online. The constant connection can lead to mental exhaustion and make it harder to relax and focus on homework. Social media can also expose teens to more negativity than they would normally experience in person. People often feel more comfortable being rude or judgmental online because they don't have that face-to-face that person to directly. Comment sections can be harsh, even seeing negative comments and content that isn't even directed at you, and it can affect your mood drastically. For high school students who are still learning how to handle emotions and criticism, this kind of environment can increase stress and anxiety. So why does social media affect teens more than adults? First, the teenage brain is still developing, especially the parts related to emotional regulation. That means teens can feel more intense emotions than adults. Second, high school is a time where teens are forming their identities. Social media can influence how they see themselves and what they think they should be. Third, peer approval. Even though you think it doesn't matter, in adolescence, we think it does. When approval becomes public and measurable through likes and views, it can feel more personal and more stressful. It's important to say that social media isn't entirely negative. Many teens use it to stay connected, express themselves, and find communities they don't have in real life. It can also spread awareness through important topics, including this topic, mental health. The problem isn't social media itself, it's how much time we spend on it and how much influence we allow it to have on how we feel. There are a few ways teens can use social media more healthily. Setting boundaries can help, like limiting screen time and avoiding social media before bed. Curating your feed by unfollowing accounts that may cause stress or comparison can also make a big difference. Taking breaks is another important step. Logging off for a while doesn't mean you're missing out. It can actually improve your focus and your mood. Lastly, using social media intentionally instead of scrolling out of habit can lead teens to feel more in control of themselves. Social media is a major part of modern day high school life, and it's not going away. But understanding how it affects the mental health can help teens make better choices. Now I want to talk about some real stories behind the screen. And what I mean by that is I want to talk about stories of real people who we have lost to suicide because of people's words. This isn't some type of joke. This isn't some type of thing that we can just laugh at. It is real, serious, and it is happening every day. People's children are being taken away because of people's words, and it is starting to become an increase of problems. I have a few examples here, and you may have heard of these people's stories, but I'm willing to share them. Some of these people's stories you may not have heard of before, and that is okay. But all I want you to know is by sharing these stories, I'm trying to bring awareness to this topic. Thank you. Example 1. Aubrey Wyatt, middle schooler from Mississippi. In September of 2023, 13-year-old Aubrey Wyatt, an 8th grader at Ocean Springs, Mississippi, died by suicide after enduring harassment by her peers. Aubrey was described as active in gymnastics, youth programs, and in school. She was a straight-A student, and her mother had spoken publicly about bullying Aubrey faced both in person and online, and how it has pushed for greater awareness of teen bullying and mental health. This case drew national attention, including tributes and advocacy programs under the hashtags LLAW, Live Like Aubrey Wyatt, aimed at preventing future tragedies and supporting mental health awareness. And you may ask yourself why this matters. Aubrey's story highlights how relentless harassment, whether at school or through social media, can deeply affect a young person's mental health, and why support systems like counseling and adult intervention are so important. I remember whenever I first heard of Aubrey's story, I was scrolling on TikTok one day, and I saw edits of her beautiful face. I started to wonder, who is she? What is her story? And that is whenever me and my friend Allison started talking about Aubrey's story and how somehow, in some ways, we related to it ourselves. We talked about how beautiful she was and how much of a light. We also talked about how strong her mother, Heather Wyatt, is for having to endure the loss of her child at such a young age. Number 2, Phoebe Prince. In 2010, 15-year-old Phoebe Prince, a freshman at South Hadley High School, died by suicide after repeated bullying by classmates at both school and online. The harassment included verbal and social abuse from multiple peers, and her death led to national media coverage and helped accelerate anti-bullying laws and policies in several states. Why this matters. Phoebe's case is one of the early examples many schools study on how bullying follows teens every day, in the hallways, through text, through social media, and can become very overwhelming if not addressed. Number 3, Megan Meyer, teen cyberbullying case. Megan Meyer was a young teen whose suicide in 2006 was linked to cyberbullying through social media websites. That case became widely discussed in the U.S. and later led to new discussions and efforts around cyberbullying and prevention policies. You may ask, why does hers matter? You may find yourself asking, why does Megan's story matter? Megan's experience shows that bullying doesn't have to happen in person to be harmful. It can also be online and even be anonymous or disguised users. It can deeply affect someone's feelings and worth of belonging, tell them to end their life. Case 4. Jaden Bell. Bullying based on identity. Jaden Bell was a 15-year-old student from Oregon who was intensely bullied for being gay. His death in 2013 sparked national conversation about acceptance and tolerance in schools, as well as support of the LGBTQ+ youth facing harassment. His case matters because this highlights how bullying can be tied to identity, like sexual orientation, and how it can uniquely hurt mental health, and why schools should focus on inclusive anti-bullying programs. Number 5. Next, Benedict. Bullying targeting gender equal identity. In 2014, 16-year-old Next Benedict, a non-binary high school student, died by suicide after ongoing harassment about their gender identity. Friends and family reported constant bullying from classmates leading up to this accident. Next Benedict case matters because, like other examples, this underscores that bullying, whether based on identity, appearance, or other traits, can wear on a student's mental health over time. This is where I want to get a little personal for a second. If you are thinking about hurting yourself, if you are thinking about doing anything that could temporarily or even permanently end your life, there will always be resources for you to go to. Helpful resources for teens include the 988 Suicide and Crisis Lifeline. Call or text 988. They are available 24/7. The Crisis Text Line. Text HOME to 741-741. The Teen Line. Text TEEN to 839-863. You can also tell school counselors, teachers, or trusted adults. Your value isn't determined by likes, followers, or views. Taking care of your mental health is always important. And with that, thank you for listening to another rendition of Behind the Screen. Take care of yourselves and each other, and I'll talk to you later.